When we think about infrastructure, we think about the building trades, and then we also think about the care economy, two sources of infrastructure. Anna, I'd love to hear from you from the perspective of philanthropy, how we address inequities in the care economy, and how does addressing inequities in the care economy help overcome occupational segregation and the systemic devaluing of women's work, and what is philanthropy's role?
Well, thank you so much, Anne-Marie. And I just want to say how thrilled I am to be here and see all of you in the room. I also want to thank Wendy Chun-hoon and the Women's Bureau to bring us together to really think deeply about equity and equity in implementation, which is so important. Is my mic on? Can you hear me? Great. My name is Anna Wadia, and I am the Executive Director of the Care for All with Respect and Equity Fund, or the CARE Fund. The CARE Fund is a collaborative fund that brings together a diverse range of foundations with the aim of investing $50 million over 5 years in movement building for a universal, publicly supported care infrastructure. We take a holistic approach to care and caregiving across the life cycle and across generations. This means policies and programs that improve the livelihoods of paid and unpaid caregivers and the quality of care for all who need it. So why have so many foundations come together and decided that this is the moment to invest in a holistic approach to the care economy? You know, I like to say that the pandemic ripped the invisibility cloak off of some really deep truths about care that had just been hidden in plain sight for so long. First, care is at the crux of systems of oppression by gender, race, age, ability, immigration status, and family structure. In our economy and society, we grossly devalue everyone who provides care and also everyone who needs care. And so winning robust care systems and supports can be a linchpin to unravel these legacies of oppression. The other thing that became so clear in the pandemic is that care is not only essential to thriving families, but it is also fundamental to a thriving and equitable economy. Sitting here in the Labor Department, I think I can say that investing in the care economy impacts both the supply and the demand for labor in dynamic and reinforcing ways. The professionals who provide essential care, education, and personal support to children, to older adults, and to people with disabilities, they are among the lowest compensated workers in our economy. Due to the occupational segregation that SJ talked about, they're predominantly women and disproportionately women of color and immigrants who barely make minimum wages and rarely receive benefits. At the same time, most workers, all the rest of us, are also caregivers or need care to thrive in our workplaces and communities. And because in our society, women take on the majority of care responsibilities, inadequate childcare, no paid leave, barely any funding for long-term services and supports, this all hinders women's ability to get jobs, to stay in jobs, to move up career ladders, and actually to accumulate assets for financial security and retirement. So we have a situation where families can't afford the care they need, and at the same time, the women, predominantly women of color, who work in care receive poverty wages. So to address this affordability gap, and at the same time to fuel our economy, we need massive public investment in care infrastructure. So that brings me back to the CARE Fund and our theory of change. We believe that we need to resource all the movements for care and also support them to come together, to build and aggregate their power because we have to generate political will for bold public investments, investments that meet the needs of workers, of families, and of care consumers. So that's why we've been supporting movement building networks, some of which you'll hear from in the next panel, and coalition tables to advocate for care at the federal and state level. Moving forward, we'll continue to support this movement in power building, as well as narrative and culture change and policy innovation, and most relevant to today's meeting, implementation for equity. So as one example, the American Rescue Plan includes historic investments in care, actually almost $40 billion for child care and almost $13 billion for home and community-based services. And also billions that states and localities have the discretion to use for paid leave and other family-friendly policies. And as we've been discussing today, there are, of course, many other streams of federal money going to states, localities, and tribes. So there is a huge opportunity to use these funds strategically to deliver equity. What does equitable implementation, though, actually mean when it comes to care policies and programs? First, no matter what the policy, it is essential that all stakeholders are at the table as plans are designed and implemented. So this means care workers, parents and other family caregivers, older adults, and people with disabilities. Second, whether we're talking about childcare or home care, given occupational segregation, equity has to mean dedicating funds to improving care jobs. Almost all states are using American Rescue Plan dollars to improve home care worker compensation, and over half the states are increasing compensation for child care workers. But unfortunately, given the time-limited nature of those funds, many of these compensation increases are like one-time bonuses or temporary increases. Third, across sectors, training opportunities have the potential to improve the quality of jobs and the quality of care. But it's essential that to be equitable, these training opportunities need to be affordable and accessible to the predominantly women of color incumbent workers, because otherwise they risk being displaced. There are also many ways to bake equity into specific care programs and policies. In childcare, as we've heard from other panelists, women in construction, as well as in more traditional sectors like nursing, retail, and hospitality, they need childcare at all hours because of their volatile work schedules. Equity also means targeting funds to historically underinvested communities and coordinating programs such as childcare, home visiting, mental health, and early intervention services to effectively serve families with complex needs. As states use federal dollars to invest in home and community-based services, they have many opportunities to expand eligibility and make it easier for consumers to apply for benefits. And for years, paid leave advocates have been learning what it takes to make programs equitable, including progressive wage replacement, broad family definitions, and culturally appropriate outreach and education with trusted messengers. So given the incredible opportunity presented by the American Rescue Plan and the other federal streams we're discussing today, many of the movement building groups we've been funding, like Caring Across Generations, Family Values at Work, and the National Domestic Workers Alliance, are deeply engaged in making sure these policies are implemented equitably. And we'll soon be announcing an additional set of grants to organizations that are providing technical assistance to state and tribal administrators to help them implement these funds in equitable ways. And equally importantly, many of these grantees will also be providing re-grants to local advocates to hold their state and tribal administrators accountable, and also to document and tell the stories of impact, because what we have to do is we have to make these temporary dollars, we have to make them permanent and long-term. Thank you.